If you take the spine issues, basically the people will get neck pains and back pains associated with neurological disorders such as when we talk about neurosurgery, mainly the brain and the spinal cord comes under this subject, and people with spinal issues comes to the neurosurgeon more frequently than the brain problems. If you take the spine issues, basically the people will get neck pains and back pains associated with neurological disorders such as numbness or weakness of any of the limbs or both limbs, and sometimes they get difficulty in passing urine and controlling bowel. At the same time, there may be issues of imbalance. So these are common symptoms associated with spinal issues. And even though these issues are there, it doesn't mean the patient needs a spinal surgery, but it has to be properly evaluated. When we talk about the brain problem, we get brain tumors, bleeds in the brain, sometimes the pressure in the brain might be changed. As a result, people might develop difficulty in speaking, sometimes weakness of one side of the body, as well as unconsciousness or even a fit is a possibility. So when these symptoms are there, the patient has to be evaluated properly and come to a diagnosis. If that diagnosis warrants a surgical approach or surgical treatment, we have to offer the patient that treatment. But we have to remember, out of all the problems, the surgical treatment is needed only for a very, very small quantity, such as about 5% maximum of all the problems. So, rest of the 95% of the patients will need therapies related to medicines, behavioral changes, exercises, sometimes psychological support. These are the common support treatment modalities available for issues related to spine and the brain. And we will talk about in detail each problem in future programs.